Hello everyone, I am Dr. Cynthia Singh, ENT surgeon. We have with us Dr. Kshitij Chiraya. He's head ENT consultant in Indus Group of Hospitals. Hello sir.
Hello, Cindy.
We are going to here talk about the Advanced ENT lab and what is the lab about and किस तरह से it's different from the other hospitals. Can you put some light on it, sir?
Right. So, Dr. Cynthia, I always had a dream to have a place where a patient with different ENT problems can come and they get diagnosed and treated accordingly. Unfortunately, there was not one roof under which all different ailments could be diagnosed and treated. So, hence, it's a dream come true for all of us.
Yes, sir. How is it different from all the other labs in the entire city, sir?
The difference is that here, the patients with hearing issues, the patients with vertigo, patient with voice problems, patient with swallowing problems, patient with dizziness, and patients with other speech problems can all be diagnosed in under one roof along with the allergy tests.
That's very nice, sir. So as you spoke about the dizziness, you have been treating and diagnosing vertigo or dizziness for a very long time. What is that special we are doing for the patients in this laboratory?
As we understand that the diagnosis of vertigo, the history is paramount.
Yes.
But once you have taken the history, you need to diagnose between various entities. And for that, there's a test called video nystagmography. It is a state-of-art test in which patient is made to wear special goggles, and then the patient's eye movements are recorded so that we are able to see what exactly is the cause of diagnosis. See, Cynthia, vertigo itself is not a diagnosis.
Yes, sir.
It's just a feeling of spinning. But why is that happening? If we are able to find that, then we are able to treat that. And I can say it very proudly that we have already performed more than 600 of these tests and have been able to help those patients in need.
Yes, sir. So moving on from the dizziness, what are we special doing in the nose department? Are there any tests conducted for the nose also in this lab which are different?
Definitely it is. It's a feather in our cap. So we recently imported this machine called rhinometry from GM Electronics, England. This is one instrument which measures how much air is passing through each nostril individually as you and I are breathing. This way we come to know how much is the problem in breathing and can medicine make it any better. You can also assess the response of medicine as well as nasal surgery. It provides objectivity because it can measure how much air is going through the nose.
Yes, sir.
So, and I can proudly say in north of Delhi, we are the only facility having this test.
Yes, sir. Also, sir, we have hearing tests, a normal hearing test in all the labs in the city, in all the clinics in the ENT department over here. But how is it different in our advanced ENT lab?
We have a proper sound treated room. We have a qualified and registered audiologist who is a professional doing these tests. In addition, we have 3 specific equipments. One is the audiometer, which perform the routine tests. In addition, we have something called an impedance audiometer, which tells you whether there is a fluid behind the eardrum, is there any stiffness in the ear bones, because many patients they have ear fullness because of the fluid behind the ear. So we are able to diagnose it in kids as well as in adults.
Yes.
And we have third special equipment which is called otoacoustic emissions. In a very small child, 2 days old, 5 days old, 10 days old, a month old, how will you know whether the child is hearing or not?
Yes, sir.
So with the help of these tests, within a minute, we are able to assess whether there is any issue with hearing or not, so that we can catch them early and treat them early.
Yes, sir. Sometimes we get such patients in the OPD, they say that they have a sensation of pain or they have something stuck in their throat. What do we have something for those patients?
Very good question. This is an extremely common complaint that we have. That patient get a feeling of something stuck in the throat, a lump in the throat. They have to clear their throat like vigorously.
Yes.
And many of these patients also have difficulty in swallowing at times.
Yes.
So in the lab, we have 2 specific tests for them. One test is called fiber optic endoscopic evaluation of swallowing. In this, you make the patient drink liquids, you make them eat solids, and with the help of a special Japanese endoscope, which is inserted through the nose, we are able to see how are they swallowing, where is the problem lying, where is the problem, is it a problem of throat, is it a neurology problem, or what is happening. In addition, the second test which I am going to talk about is called a video fluoroscopy. In this, your patient is made to drink a special liquid, and then a special machine records like an X-ray. It's a dynamic X-ray, it's a video of an X-ray, you can say. Then this is recorded, and you can see that the fluid, that liquid is in the patient's mouth, and as the patient swallows, you can see it passing through the throat, into the food pipe, and into the stomach. That way you get to know where the problem is, what kind of problem is. So with the help of these two tests, we are able to help and treat many patients with swallowing problems.
Nice, sir. Sir, I have one question. As you discussed about the endoscope going through the nose, is it painful for the patients?
Not at all. That is the beauty. None of the tests which we mention and do are painful. These endoscopes are of such tiny size that they pass through the nose of even a very, very small child, leave apart adult.
Yes.
So there's nothing to be scared of.
Yes, sir. And sir, like we have so many empanelments these days. We have general patients and we have empanelments like insurances, like ECHS, ESI. Do we have all of these tests registered in those empanelments in endoscope of hospital?
Yes, we are very fortunate that way, that almost all empanelments and all the insurances are available in the hospitals. So many of these tests in inpatient especially are covered by the insurances and empanelments. Cynthia, if I may, there are a couple of more things I would like to talk about.
Definitely, sir.
Many of us, like we are ENT doctors, so many patients come to us with problem of voice. Teachers, mothers, street hawkers, musicians, professional singers. So how do you know what is the problem in their voice? Why are they not able to sing? Why exactly is the hoarseness? So of course we can see that with the help of fiber optic scope, which I just mentioned. But we also have a special area in which the patient's voice is recorded and then the software analyzes it. Each and every character is analyzed and we get to know where the problem lies, how has the frequency of voice changed, and what measures, medical, some kind of physiotherapy, speech physiotherapy or surgical can be taken to improve the voice. Lastly, we are also performing the special skin prick test for allergy, and the allergy patients are being treated with specific immunotherapy so that allergy is treated from the root.
Thank you so much, sir, for everything. This was a very fruitful session. I believe all the patients, everyone in the entire place to understand that what we have in the advanced ENT lab and how it can help them. Thank you so much, sir.
Thank you very much on behalf of my department.